Well, hello, welcome. You're watching ICRC-TV's COVID-19 HR updates. My name is Pandy Pridemore, founder and principal consultant for the Human Resource USA. I am so excited. I've been prepping you for this show. If you've been watching for the last few months, you've watched us gradually and progressively get deeper and deeper into the solutions. First, the evaluations of what's been going on for the past 6 or so months of this pandemic, but now we're starting to work more into solutions. What are we facing with this unknown future, and how do we deal with the changes that are occurring now within our small businesses? Well, I've got two wonderful presenters, and I have to stop and pause because you guys know how long it's been that I've been trying to get these two on the show, not together, but individually. I was laughing with the one. I said, gosh, I've been fighting for 2 months to get you guys on the schedule. And the other obviously is so overwhelmed and so busy with their responsibilities with this pandemic that they weren't able to make it last show 2 weeks ago. Now we've got her on today. So I know this is material that you're going to appreciate. It's not necessarily so focused on HR, but it is very much focused on how the pandemic is affecting each and every one of you, whether you're a small business owner or an employee. So, and by the way, the last 2 weeks has brought on a tremendous amount of change. So we've got a lot of conversations to have even outside of what our two presenters are going to give us. So hold tight and know that we're going to give you information that you can instantly apply. So let's just dig right in. Our first presenter is Kate Harrelson. Now, Kate's the project manager for the Health Collaborative. And if you haven't heard of the Health Collaborative, this is going to be good information for you. Here at the Human Resource USA, we sent out the testing sites available for both Kentucky and Ohio residents, because again, testing's a major key in understanding this pandemic. Well, the Health Collaborative is where I got my information. The Health Collaborative is the group that actually started feeding me why this was important. And they were actually referred to me by Mike Salmon. If you remember having seen Mike on the show here a couple months ago from the health department, Mike's led me into and gave me the great secret of the Health Collaborative. So Kate has got a tremendous of information for us in regards to what's going on there and just how important their presence is here in our community. And then Stephanie Bird. Now get this. Regional CEO of Central and Southern Ohio regions of the Red Cross. Do I even need to say anything more? Do you understand why it was hard to get her on the show? So I'm patting myself on the back for this one. The Red Cross, who doesn't know the Red Cross? Who hasn't been touched or influenced by what the Red Cross can do for our communities? And Stephanie's going to share with us today just how much the pandemic has affected the Red Cross's efforts and all of the wonderful things that they do and the activities that they provide for businesses and employees. So it's not something we're thinking about, right? It actually took my brother, who teaches for FEMA on disaster responses. It was actually him who kicked me in the rear and said, "You mean you haven't had them on the show? You mean you're not helping your viewers understand just how much emergency response has changed with the pandemic?" So Stephanie is going to help enlighten us a great deal. And I want you to have your pencil and paper, as I tell you every show. Have your pencil and paper ready, because she's got some to-dos for you that you really want to take in seriously as you're going back, whether you're in the workforce or whether you're not. So Kate, why don't you just kick us off?
Sure.
And who the Health Collaborative is.
Yeah. So the Health Collaborative, I'll start by talking about what we normally do in a non-pandemic time. We are the regional health information center. So all of the health data in our region, and that's greater Cincinnati, includes parts of Indiana and Kentucky, flow through some servers that we have in our building. And that allows all of the hospitals in the region to talk to each other. So if you have a provider in one system that needs to get some test results to another one for a patient, we can help them talk to each other. We also, because of the way we're positioned then, have a lot of partnerships with our regional health systems, just generally through their day-to-day clinical operations. So we do a lot of work with improving primary care operations, with working on community issues, neighborhood-based initiatives specific to health. We do a lot of health IT things, and then we do disaster preparedness. So we've been in the background for a really long time, not me specifically. We have a team that has always been dedicated to disaster preparedness, and they've housed physical resources. So, we have supplies and things like that we take care of and maintain for our region. And then plans. So they, and building relationships and networks and communication. And so we have this team that's been working on that for a long time, putting that in place for times like this. Now, I don't know that we ever expected that we would be dealing with a pandemic. If you followed us earlier this year, or it might have been the end of last year, we had a test run of a disaster at Great American Ballpark. And we pulled together all of the different agencies that would be part of responding to a large scale disaster that had multiple injuries and casualties and things like that. So that included fire departments, police departments, even Metro, all of the hospitals in the area, our emergency management agencies. So we got really good at doing those like one day disasters. And now we just had to take that one day disaster and multiply it day over day and keep trying to respond as we get further and further into that pandemic. So normally the Health Collaborative, helps facilitate disaster response and preparedness. And now we're actually in it full time. So that's kind of where we sit right now.
Who are you funded by?
Oh, okay. So we are funded. We actually have a lot of different funding sources. We're a member organization. So the hospital systems and then other care partners in the region pay us member dues and they get services. We get some funding through that. That helps fund our health IT initiatives as member services and some other things that we provide. We also get a lot of grant dollars. So specific to our COVID response, we have money from CARES Act through Hamilton County. And then we also have Ohio Department of Health money. And the Ohio Department of Health money is more of our ongoing disaster preparedness and response. The CARES Act funding is specific to COVID, COVID testing and in Hamilton County. So that's where our funding comes from for that.
What were the biggest changes you saw with the pandemic? Because you said you were preparing for this, but come on, reality is always a little harsher than pretend.
Yeah, my job before COVID was not COVID. I think that we're a very small organization. We have about 60 folks, and we do a lot of different things with our hospital system partners and our other community care partners. We were working on things like anti-human trafficking, and we were doing, like I mentioned, primary care work and medical marijuana work and all of that. And when COVID hit, there was no emotional or mental bandwidth for the clinicians to even think about any of those things. And so I think we all just pivoted very quickly because we're a member organization. We really are here to serve our members, which is the healthcare providers, and then through them, our neighbors, the people who live in our region. And the biggest concern was COVID. And so how did we all pivot to use the skills that we already have to serve the community during a pandemic? And I think those have been the biggest changes, is that we've all had to sort of abandon the things that we were doing, or at least put them on hold for a little while, and help everybody just get through this really hard time, and acknowledge that we're all learning this as we go. We joke constantly in our meetings that we're building the roller coaster while we're on it. But what's been exciting, I think, so while a lot has changed in terms of our, like, the people that we're meeting with and the things we're talking about, we've all leveraged the skills that we already had to respond to this. And we just had to get creative and get really scrappy. Our CEO likes to say we're scrappy. So
well,
yeah.
Being able to turn to you
Yeah.
on that recommendation to learn more about what you do, but also how to provide resources to my clients. And now
Yes.
I'm trying to bring those same resources to the viewers of our show.
Mm-hmm.
That seems like a natural then thing for you to do, is to put a list of the testing sites. But how does somebody become a testing site for you?
Yeah, so there are a couple of options. Just as part of the grant that we got through the CARES Act, we are doing testing in Hamilton County specifically. Now, if you're outside of Hamilton County, Ohio, we have some other resources, we can share an email address that you can email later if you'd like to find out some other resources.
Okay.
You can either submit a request through our website. Actually, that's the main thing you want to do. So if you go to our website, it's healthcollab.org/test and protect. And we can make sure that some of those resources maybe are available in writing later, because I know it's hard to write that stuff down while I'm talking. But you can submit a form on our website, and you can either be a private testing event. So say, for example, you work in a restaurant, you manage a restaurant, and you've got 3 employees now that have tested positive, and you know that they were all working at various shifts, and most of your staff have now been exposed. You can submit a request through our website, and then we will triage that request to UC Health, which is one of our partners. And they are helping with a lot of the field testing right now. And they can show up and do testing for your staff. Mm-hmm. Say that again.
I had no idea. That's
Yes.
Great information. We didn't talk about that.
Mm-hmm. Yeah, so that is one of the options. And, like I mentioned, any organization that senses an outbreak or catches wind of some positive cases and exposures can request testing through that website. That's what this money is there for. We want to be able to come to you and bring that testing to you and remove barriers to that. Or now the other option is, if you just know you have a really great space, especially now that it's getting colder outside, it's getting windier, hopefully it starts raining a little bit more soon, you can offer up your space to open it up to the community. So as an example, we've been working with libraries, YMCAs. We've even started working with some municipal buildings, and they're letting us come inside their spaces. And of course, following all the safety precautions and necessary social distancing guidelines. But we're able to do repeated testing events at some of these locations. And those have been the ones that have been really helpful. I think when, we're getting phone calls from people who are like, I've got to fly in a plane to go somewhere, I need to get tested, or I want to, I need to know I was exposed and I just need to go get tested, in the next day or so I can stop quarantining in my bedroom from the rest of my family, things like that. And we can point them to some of our regularly scheduled testing events that they can just drive up to, get tested, and get the results back within 2 to 4 days is typically the timeline for that.
Oh, that's fantastic news.
Yeah.
Because there's a lot of space available right now.
Yes.
So many facilities are not at full capacity. They've got huge, so they have huge cafeterias, and that just brings the accessibility to the community.
Yes.
Faster.
Yeah. Yeah, we've actually also found parking garages are really great. So if you have a good parking garage that you want to offer up, we will take it.
Those are empty. Those are empty.
Yes, yes.
What kind of equipment is necessary? Do they have to have access to the facilities, or do you need running water?
Yeah, so there are a couple of basic functions that we like to have, and actually, I could probably pull it up. We need to have access to some electricity at a minimum, because we have, some things that need to be plugged in and hotspots and things like that. And bathrooms are ideal if they're available, but not required. Let's see, we prefer our sites to be accessible. So for folks who have physical disabilities, it's really critical that they also have access to testing, and making sure that that's a consideration. Trying to see, we also offered both drive-through and walk-up testing capabilities, so we can accommodate either. Drive-through is a little tougher. We need to make sure that there's really good traffic management. So if that is something that someone wants to facilitate, we'll have to work a little harder to come up with, some accommodations for that. I was just going to pull up the list. So established entrances and exits, we need to have them separate so that there's a throughput and we're not having a lot of, people crossing. That's part of safe social distancing. We need to have adequate parking. That's pretty critical, especially if it's a walk-up space. I already mentioned access to power. Tables and chairs are ideal. We can bring some if we really need to, but it's helpful to have those. A staff member at the facility who can give us access. So this has been an issue for us finding weekend sites. I know that sometimes places are closed on the weekends and they're like, you can come and use our space, but then there's no one available to come and let us in. And then if it's an indoor testing location, we need to have good ventilation and 24-hour HVAC running. So those are kind of the main pieces. And then, of course, it needs to be a large enough space to have people at least 6 feet apart.
Just right off the top of your head, are there any geographical areas that you're searching for locations in?
Yeah, the West Side specifically.
Oh, okay.
Yeah, we actually have really great data support, for our team, and they do some really sophisticated things in figuring out how we can have dispersed test locations throughout the region, so that nobody is further than like a 10-minute drive from a test location. Some of our team members have been really helpful, and these are our partners, not even just the Health Collaborative. We work with a lot of different partners throughout the community that are contributing to this project. So I should preface, I'm talking about all these things. I don't do all these things, just so everybody knows. Yeah, I don't do all these things. But so one of the things we've been looking at is everybody in Hamilton County at no more than a 10-minute drive from a testing location. And ideally, even on a bus route, right? You shouldn't have to make a bus transfer to get somewhere. So we're working on some of that as well. One of the bigger gaps we've seen is getting test locations on the West Side. We've been making some inroads, and we've had some really good buy-in from some of the organizations over there. But we could do a better job. So we're, if there's anybody listening that has any ideas, we'd definitely be willing to come and check out your space and see if it would be good for hosting a test event.
Oh, I feel so good that you've had the opportunity to do this, because we did not talk about this. This is so cool.
Good. Yeah.
So cool. Let me ask you this. Oh, go ahead, Stephanie.
Well, I just wondered about the testing. So if this is just based on people wanting to go visit loved ones, which I know isn't a good idea right now, but if you're tested and your test comes back negative, is it enough to wear a mask and to make sure that you continue to maintain social distancing when you go visit someone? Or
that's tough, and it's hard for us to comment on that. What I will say is, I would recommend, because I know you've got a national audience, right, Pandy? Okay. So there are a lot of tools online. There's a risk assessment tool specifically And if I can find the link, maybe I'll send it and you all can post it on your website. But there are lots of tools online to look at the risk of catching COVID wherever you live. There's one in particular, it's called, I think it's like COVID event risk assessment or tool or something, if you Google that. And it tells you the likelihood that if you go to an event with 10 people, what percentage of those events will have at least one person that has COVID. So, and then if you increase the size of the event to 25 or to 50, that percentage goes up, right? So you asked me if you should go visit your family. I'll speak for myself. We're doing everything we can to stay home right now. Even if we get tested and even if you get tested and you quarantine and then you go to visit that family member, I mean, that is the safest if you're going to do it. But we really all should chalk this Thanksgiving up, chalk this, these holiday seasons up right now to protecting each other by staying home is probably the best recommendation. That's the only way you'll guarantee you won't get it or give it to somebody. So, because that might not be the answer you wanted to hear.
No, but it's one I needed to hear.
Yeah,
for sure.
So,
we are hearing so much about COVID fatigue. There's so many people who are just, especially within my clients, who are saying, look, I'm done with this. I want it over. I don't care. We have to go back to normal. This has to end.
Yeah.
And we've heard from the health department, but from the perspective of the health collaborative, who should be testing at this point? Because I've got people who are saying, look, I don't care if I get it. It doesn't matter. Who should be testing and when should they be testing? Because I've got even individuals who are now saying, well, they're looking at third-party transmission. My kids got it because their teacher tested positive. So should the individual who's the employee leave because now she can transmit it to the workforce? From a health collaborative standpoint, who should be testing?
Yeah, so it's a little hard to pin down how often you should be getting tested. If you're working remotely, like for myself as an example, my kids, their school's going remote next week. So after next week, and both my partner and I work from home. After next week, we won't really have any contact with anyone. So we probably won't worry about testing that often. Now, if you're a frontline worker, you may want to get tested more frequently. It's going to depend on your comfort with it. And, there are lots of different recommendations out there, weekly or so. It depends on your comfort and how you can fit it into your schedule. Now, if you're exposed, you definitely want to get tested right away if you know you're exposed. And an exposure is when you've had sustained contact with someone who tested positive. That's what an exposure is. So you definitely want to get tested. If you find out you've been exposed. The other thing I'll say to that is that we know that about 40% of folks who test positive are asymptomatic. So you're not demonstrating a fever, a cough, a runny nose, your loss of smell and taste. And then there's all these other strange, less common symptoms that we're seeing now. I'm hearing COVID fingers and toes. I'm not quite familiar with that. Pink eye, all of these things. So you may not have any of those and you still have it, which means you're potentially exposing a lot of other people. So, periodically you may just want to get tested. If you've been relaxed and going out and being in public with, you either being in public with large groups of people or spending a lot of time with folks, if you're using, I'm trying to think of good examples, but if your bubble is big, you should probably just go get tested periodically to know. I get tested regularly just to just to know, also because I work on the project and I like to be able to tell people what it's like to go through the testing process. So I subject myself to it periodically. I have a family member who works in the YMCA and he's around people often. And so he goes and gets tested about once a week, just to know. So it really is, it's a little bit of a comfort level thing. I wouldn't say the Health Collaborative has specific recommendations, but there are enough resources out there that you can get tested as frequently as you think you need to keep yourself and your family members safe.
Well, if I heard you correctly, Kate, let me, and correct me if I'm wrong, but what I think I heard you say was it's best to go ahead and get tested so that not necessarily to know whether you're actually carrying the virus, but so you know you're carrying the virus so someone else doesn't pick it up from you.
Absolutely. Yes.
So that's probably the biggest picture that we need to paint with this is it's how you're affecting the ones around you. So that we can all, to Stephanie's credit, go all back to our family and the lives that we wanted. It's not going to go away. We all know this is not going away. But we do need
someday.
I'm convinced the show may go away, but I don't think the virus is going to go away.
Yeah.
So let me ask another question too. We've got individuals crossing the border. So Kentucky, Indiana, Ohio, we're all real close here. If we've got somebody in Hamilton County working, but a resident of Indiana or Kentucky, are they welcome to come to one of our test sites here in Ohio, or do we have?
Good question. Yeah, so if you work in Hamilton County, you can get tested at any of the Test and Protect locations. So the Test and Protect, which is what we branded the grant, the CARES Act funding that we have, is Test and Protect. If you work or live in Hamilton County, you can get tested at no cost at any of our locations.
No cost.
Yes. Now they will
hear that. Everybody hear that.
Yes.
No cost, not to even insurance.
Yeah. So what I will say is they will ask for your insurance. And some of that is so that there's a little bit of cost sharing going on. Periodically, people by error will get a bill, but we work with them. UC works with them, the county works with them. So it really shouldn't be there should not be a cost, because the goal here is surveillance testing, right? We moved from where we were testing people who were symptomatic to know if they had it, and then we could quarantine, isolate them from other folks. But now we have enough resources that we've moved to surveillance so that we can catch. Surveillance is when you do sort of, broad level work and testing, just for folks who aren't familiar with that public health term. That helps us identify folks who are asymptomatic before they become symptomatic. And by then they've already exposed potentially, a lot more people to it while they weren't showing symptoms. Sure. So it's no cost if you live or work in Hamilton County. Now, if you don't live or work in Hamilton County, there are lots of other initiatives like this in the region. Right. I know mostly about the ones in the Ohio counties north of us. Health Source of Ohio is a really good resource for a lot of the surrounding counties. They offer regular testing in their clinics. And I think they also do some strike team testing. Strike team testing is when you show up at a location to test people in an organization. I can't speak as much for Northern Kentucky or Indiana, but since a lot of this is CARES Act funding, there are similar initiatives going on throughout the country. So I'm sure that there are similar resources in Indiana and Kentucky as well.
Kate, I can't tell you how much I've enjoyed this conversation.
Yeah, good.
You have pleasantly surprised me. I knew you were going to be fabulous. Okay, we put that on the table to begin with. But guys, viewers, listen to what she just heard. Okay, not only do we get there's free testing here in Hamilton County, but the CARES Act is providing this kind of funding for anywhere in the country. Mm-hmm. So if you are one of my viewers in Texas or Colorado, Arizona, guys, there are similar resources. And I'm sorry if you don't have that in front of you, but I'll bet if you even, contact the station, let me know you're looking and I'll get a hold of my contacts over in those regions and we'll find you the ability, because what she has stressed more than anything is that testing is imperative. It's a part of the solution to this pandemic that we have right now. And we all have to, we have to do this as a team. We all have to come
Yes.
together to solve this. The government's not going to solve it for us. Put them aside. This is up to us, okay? And we have the resources to do that, thanks to the government. So let's use them wisely. Kate, thank you. Thank you so much. Is there anything else that you want us to know before we move on to Stephanie?
No, just thank you for your time, and thank you for letting us, share this great resource we have through December 30th. I want to add that too. Through December 30th is when our testing initiative is available. And we want to test you. We want to help keep you and your family safe. And as Pandy said, this is something we all have to do together and take care of each other. So thank you.
You mentioned an email address for resources. Please send that to the station. We will make sure you gave it to the viewers. They can rewatch this on YouTube, obviously, and pick that up. But if you send it to the station or email it to me, I'll make sure that it's available for anyone asking. Gosh, thank you.
Thanks.
All right, Stephanie, you've got a big one to match here, and I know that you will have no problem doing that.
Won't even try. I was taking notes as Kate was talking because there's really great information. I've been wondering about testing myself, so I was excited to hear that it's so widely available. Wonderful resource.
Yeah, but my brother really did shake me up here when he came in from Arizona and said, "Why in the world have you not engaged with the Red Cross so that they can share how the pandemic has affected them and the whole concept of emergency response?" And you and I over the phone kind of talked briefly, but again, yes, the show's on COVID, and yes, it's supposed to be HR driven, but you tell the viewers, tell the community what you feel is most important that they know about what's going on right now.
Sure. Well, I'm excited to be here, and getting to hear Kate's information about where we are as a community and what's available is so important. From day one, the Red Cross has known how dangerous COVID-19 was going to be, and really moved to do whatever we could to protect the safety of our employees, our volunteers who we rely on heavily, and our clients. Because so much of the work that we do is up close and personal. I mean, our lines of service are not remote services. They're ones that require that we are working face-to-face, hand-to-hand, oftentimes with people who need our help. Our mission is to alleviate human suffering in the face of emergencies. And so emergencies require more personal connection than we knew COVID-19 was going to allow us to have. And so in all of our lines of service, we really had to step back and think about how we continue to fulfill the mission, but by keeping our employees again and our volunteers and our clients safe. And obviously, we are not the experts in COVID-19. We are learning, like I'm just learning from Kate, all of the time about what the latest science tells us and what the CDC and what the state is telling us about the appropriate precautions to take. Those are our guides, just like most organizations. And so we are very, very careful about making sure that we're implementing those practices, but we've had to adapt them to our own environment. And so in our three primary lines of business, which are our blood services program, where we collect blood, 40% of the nation's blood is provided through the Red Cross. We've had to really shift the way we screen our blood donors. We saw a huge shift itself in how blood donations were being made possible because of employers no longer having staff on site. So many of our blood drives are on site at companies. And when companies began to have their employees work from home, we didn't have access to those employees in those locations. And so we've had to shift how we offer sites to more community-based drives, and are now very, very careful about how our clients present. So when they show up, taking temperatures twice during the process to make sure that they don't have a fever. The PPE requirements of both our clients and our staff are huge. All the things that the CDC requires in terms of masks and gloves and social distancing. We took our mobile unit, our bus, out of operation because the way it is equipped made it impossible to maintain the safe distancing that is required or highly recommended by the CDC. So really had to rethink the blood donation process and what we were telling our donors as they were scheduling and what our staff had to do to make sure that both were safe in the process. We created a whole new volunteer role, in fact, called blood donor screener that we've never had before, but they ask the screening questions of blood donors as they arrive. They do the temperature taking upon arrival, and then make sure that the blood donor knows what the conditions are in terms of their safety while on site in the blood donation location. And so obviously we've been able to continue to collect blood, but we again had to step back and say, how do we do this differently? Our training services program, also similar in effect, because so much of what we do there is done on site at employer locations, but not all of it. So we had to think about ways of delivering the training differently. Let me back up. Our blood services program is considered essential. And so we were able to collect blood throughout the time that COVID has been with us from the very beginning until now, and will continue to do so because of it being considered an essential service. Our training services were not. And so there was a period of time where we were not delivering training services, but had to make sure that people who relied on us for their certifications, because the certifications are not perpetual, they have to be renewed. And so we had to create a way for those whose training was going to expire to continue. Now, the government allowed some of that to continue, so they extended the timeline of when certifications were valid. That allowed us to create a provisional certification that now allows people to use a hybrid method for getting their CPR and AED certification. They can do part of their coursework online, so all of the online training can happen, and then they can wait for up to a year for actually demonstrating the skills in person and have a provisional license or certification for that period of time. The other option is that they can also do the online training, but we will now send a mannequin to their job location.
Oh, wow.
And have the skills test done virtually with the mannequin. And so we've had to, again, come up with ways of making sure that they could continue to get certified, but under different conditions than we would typically have to do. In our classes, we've always used CDC guidelines in the safety that we ask students to follow. But now we've had to limit the number of students to 6. They're spaced differently. There are no shared mannequins. Mannequins are sterilized twice within a session, even though they're not shared. We now mask the mannequins and allow students to be masked when they're actually doing the breathing portion, the respirations portion of the training. And in a community setting, we're advising that people can just use the chest compressions instead of using the mouth-to-mouth that people sometimes need, or others are trained to give, just if they're not comfortable doing that. But as it relates to our being able to do the training, we're still doing it. It's still necessary for us to have people who are CPR trained, and people's licenses require that they have it. And so we just, again, had to adapt to how we're providing those classes so that people are safe and our clients are safe. And then we have the other program line that we offer, which is our disaster cycle services, and one that your brother, I know, is very familiar with, Pandy, because we respond to disasters large and small across the country, across the world. And again, that has been a very up close and personal experience where we go to sites where disasters have happened, and we've had our fair share of them. This country, we're up to this year. We're in this country, we've seen historic fires, and also hurricanes and derechos and all of those things that happen in disaster season. We typically set up congregate shelters when we have a disaster that houses the people whose homes are no longer safe, who have to be evacuated to a safe location under the guidance of the emergency management agency in that community. And then the Red Cross comes in and runs those shelters. We are not able to do congregate sheltering by and large in most communities. Now, we've had to where the numbers have been huge, but we have smaller shelters and more of them. But our go-to this season has been sheltering in hotels or in dormitories or in places where families can be in their own space and not within 6 feet of another family or another individual. And that has required that our shelter workers do different things than they've done in the past, going to hotel rooms versus going to individuals in a congregate shelter and working with them on a one-on-one basis. We have to remain socially distant, physically distant, wear masks and gloves, and deliver the food one by one versus in a more of a buffet style where food has been provided in cafeteria style in the past, again, out of safety precautions. When we respond to fires now, that's all done virtually. Our volunteers love to be volunteers for the Red Cross because they love going out and helping people when they have a need, put a blanket around them, give them a cup of cocoa or a cup of coffee, convey our concerns, but making sure that they know that they're going to be okay, giving them cash assistance that allows them then to go to a hotel with their families to be safe. We can do none of that at this point in time. All of our volunteers have been equipped with the technology needed to do remote virtual assistance of clients. And so we find out through our dispatch service what the phone number is of the family that's been affected. And we do a lot of that remotely through phone calls, tablets, and whatever technology the family has to make sure that we know what their needs are, who's been affected. If they've got medical needs, oftentimes we are able to get prescriptions filled, glasses prescriptions replaced. And we're doing all of that by remote means now and telling the client to go where to get those things filled. And oftentimes the cash assistance is provided by a debit card or through a cash or a electronic transaction that puts money on their account. And so it's made it less personal. It's made it more difficult for our volunteers who are kind of the salt of the earth kind of people who want to be available close up and can't be at this point in time. But again, for their safety and the safety of our clients.
You know, here at the holiday season, so many businesses like to gather their workforce together and do philanthropic work. And it sounds like your organization could certainly use a boost from some efforts of our viewers, because your funding probably has been affected as well. I can't imagine that it hasn't been. It's sad that you've had to make as many adjustments and as much adaptation, because you're right. It was the compassion side of Red Cross that really distinguished you from some of the other organizations.
Well, the good news, though. Oh, sorry, Penny. Go ahead.
No. So can a business get a hold of you, and can you let them know what you are in need of, even though you're having to do things a little bit differently? You are still in need of donations.
Absolutely. They can go to redcross.org/Cincinnati and get to our website. There are opportunities to volunteer. There are opportunities to donate. There are opportunities to provide in kind. And so there are things that companies can do. Obviously, we want them to be safe. But the other thing that we have created that I think companies can use now are virtual preparedness programs. We do have virtual preparedness classes that they can get online. And, companies have had disaster planning processes for a long time. A lot of our virtual preparedness programs have converted what would have been in-person classes to online to help them understand what that looks like in a COVID environment. And so, yes, certainly we want their help. We would love for them to volunteer, but we also want them to continue the practices that they need to make sure that their businesses are safe. We've created a program that's called Psychological First Aid, which helps employees, individuals, our community understand what to do to keep yourself safe in this time of, uncertainty. Because we are, as human beings, don't typically operate this way. You mentioned COVID fatigue, and our tendency is when we get tired, we do something different. This is not the time to do something different. And a lot of people are working in isolation who are accustomed to being in an office setting and working side by side with other people. Well, that does take a toll. And so the psychological first aid class really helps you understand, one, what you can do, common sense things that we need to do based on CDC guidance to make sure that we stay safe, washing our hands, using hand sanitizer, covering. We use CDC as an acronym: cover, distance, and cleanse, to make sure that people, know those basics. But then also, how do you keep yourself safe from the standpoint of managing your emotion, the isolation, the stress that comes from caring for a loved one and not wanting to bring illness to that loved one when you are the sole caregiver. So care for caregivers, in fact. And
Yeah.
so it provides really wonderful tips to help you get through what is a very unusual circumstance for human beings that are used to interacting with people and being, more social than we've been able to make sure that they're mentally strong and coping in a way that allows them to get through this, because we have to, and we will. But these are some tips to help them do so.
Well, and correct me if I'm wrong, Stephanie, but these are free, correct? They can just go in there. They don't have to sign up or register.
They have to register. They do have to register.
Okay.
But they can go to redcross.org to do that.
Okay. Are they scheduled courses, or is this stuff that's on demand?
On demand. The virtual preparedness classes, you have to register for them. So someone will help you develop that program or make sure that you've got a curriculum that fits your situation.
Oh my gosh,
but
that's
yes, you have to go on site to register them. I'm not sure about the psychological first aid class now. It started out being free. It may still be. I've not gone online to check that out for a while now, but it was free at one point in time. There may be a nominal fee associated with it now.
But we here a couple shows ago had a representative from St. Elizabeth's EAP program on, and he was very kind but very firm in saying, look, we have an issue with individuals' mental health and mental stability through all of this. Number one, change is constant, and none of us are all that good with that. But the isolation aspect and dealing with family members on top of family members who have never lived nor worked together like that. So that just kind of plays along with, again, an additional resource. And in companies, come on, business owners, we've talked about this. These are small investments. Even if there is a fee associated with this kind of a resource, that is an investment in your employees. So if you are a business owner, or you are a GM or a senior management member for your organization, please look into this resource, if nothing else, out of what you've heard from Stephanie today. Because not only is the first aid training and the CPR and all those things that we've always considered to be basic fundamentals of just taking care of our employees and keeping a safe environment, but now this mental health concept and conversation has become so much more to the forefront. And now you have another resource that no one's going to question the credibility of the Red Cross. If they've got it on their website, it's top notch. And again, this is for any business owner. This is 2 employees to 2,000. We're not exactly giving any criteria though, right?
That's right. And any individual, it's an on-demand class. It's online. And so you register and go into the link that's provided when you're registered and do it at your own leisure.
I know that a lot of our business owners are saying, I don't want anybody back into the building until after the first of the year. And I don't want to bring everybody back immediately. And a number of our essential workers have been working straight through the year, but not at 100% capacity. We've been bringing back, departments as needed. But please, as a business owner, understand the importance of maintaining that intellect and that knowledge of first aid and of CPR and some of those things, again, that are fundamental, because after a while, as Stephanie has said, you need recertification on that stuff.
That's right. That's right.
You can't expect somebody who's been gone for 9 or 10 months and just come back into the workforce and know what they're supposed to be doing in another 6 months, as Stephanie mentioned too. Some of these protocols are changing. They're being altered and tweaked and refined because of what the pandemic is expecting of us to stay safe. So please look at these resources or contact a representative at your Red Cross. Red Cross is it not international?
It is international. That is correct. We're the American Red Cross, but there is an international Red Cross. Exactly.
So it doesn't matter what state you're in. I don't care what region you're calling from. If you've got locations out of the country, you have the resources of this wonderful organization, and they need our help to not only use their services and recommend their services, but also sometimes to donate and support as well. Stephanie, what have we forgotten? What else do we think the viewers need to know before we end this session?
Well, I use the CDC because the guidelines are great, but you cannot tell people enough how important cover, distance, and cleaning really is. That's cleaning your hands. It's cleaning the surfaces that you touch, whether it's a doorknob or a drawer handle. Certainly, we're not touching each other's hands nearly as much as we used to, but cover, distance, cleanse is an absolute necessity to keep yourself safe and others around you safe. We will get through this. We are seeing a surge, maybe the third surge in this pandemic, and it's trying our patience. But organizations like the Red Cross, the Health Collaborative are going to be here for our community. We have to be. We've had to adapt the way we do the things that we do and look forward to getting back to normal whenever that happens. But if you have a need, certainly don't hesitate to call us. We're still working with fire departments to respond. We're still responding to disasters. We're still collecting blood, and all of those are absolutely necessary even during a pandemic. So is CPR training. And so please don't hesitate to go to our website to seek us out if you need help, or call 1-800-RED-CROSS if you have an emergency, because we will be there.
So I think I just want to wrap up one more thing too. One of the biggest messages we want to make here is that we need to stay compassionate for each other. We need not to be, we cannot be so frozen with fear about this stupid virus that we stop being who we really are, and that's helping each other. I mean, I think that's one of the biggest fears I have, is that we're teaching our children to accept masks, and we're teaching our children not to play with each other in close contact. We're not hugging like we used to. We're not touching each other on the shoulder or shaking hands like we used to. That's not really who we are.
Right.
And we've got to stay true to who we are as individuals, because many of the cultures of your small businesses are based on family values and taking care of each other. And when an emergency occurs, whether it's your neighbor, your relative, or your co-worker, we need to respond and not be afraid or hesitant to respond, but we need to respond intellectually and knowledgeable and be prepared. Stephanie, thank you so much.
Thank you.
Again, this was so worth the wait. Although I wish my viewers hadn't had to wait, you were a real blessing. Justice Kate, you were a real blessing. But I'm going to caveat off of something that you said a number of times, and let's stress this. Guys, the CDC is a government agency, but it's not an agency that's just for authoritative individuals or for the government. The CDC is actually made for us as citizens of the United States, right? And I don't think that their resources are used nearly enough. And I think people are somewhat hesitant to go to the CDC site because there's so much that they tend to get a bit overwhelmed. So I'm going to go over a couple of different resources. I hate to use that term, but different areas of the CDC main website that could be very helpful to each of you. And we're going to start with the first being as a small business owner, an employer. Look, they have a wonderful, what they call it, I guess a shot or a spot on their website called Printed Resources. Now, this is a great site because here in Ohio, our governor just recently put out a mask mandate, which made it mandatory for all businesses to have a mask poster posted on the front, but he's also asking for maximum capacity statements. You need to be aware of how many people you can have in a building to maintain that 6-foot distance. Well, the state of Ohio printed out or made available this wonderful little mask poster. But believe it or not, the CDC expounds on not only a mask requirement poster, you can get on the CDC printed resources page, masks, signs on how to put on a mask and take off a mask, how to interact with your neighbors, how to wash your hands. So I know we talked about this. It sounds like it should all be common sense, but if you watch any of the shows with Scott Ward, he'll tell you people don't have common sense. Even if we have it, we're not exercising it, right? So why not go ahead and just put up some posters? Some of you are having those wonderful Zoom meetings where you're talking about important things that are going on with your business. Add one of these topics to those meetings. And for those of you who actually went out to these sites and got these posters, okay, you did what you were supposed to do at the time. You posted them and you got them up. But hey guys, after something's been posted for a while, your employees completely go blind of it. You don't see it anymore. So my recommendation is you completely pull everything down that you've got and go get something that has the same message but has a different color, or has landscape versus profile. Give them something new to catch their attention. Remember, our attention span is really short, but we have to keep drilling this message in, and that's where the COVID fatigue kicks in, is we tend to see the same thing or hear the same thing over and over again. You have to kind of mix it up a little bit. I'm reaching over here because this is the maximum capacity sign that you have to have. I know it's backwards probably for you guys, but can't print it backwards for me. This actually was a freebie I found on the internet because the CDC nor the state of Ohio has one, but it is mandatory, please. And I don't care what state you're in, you need to be doing this for your location, even if you're manufacturing. I know it's really emphasized for retail facilities, but you need to be, again, acknowledging that you're aware that everyone needs to be wearing a mask nationally. You're acknowledging and making it aware that you have a capacity and that you're going to follow it for the good of the country, not just your region. The CDC also came out here in the last, let's see, it was, I think, published on the 27th or 28th of October. They've tweaked that guideline on quarantine, and that can actually be found on the page that says when to quarantine. I'm trying to get my glare here, when to quarantine on the CDC site. You're not going to like this. You're not going to like this at all. But they are now asking that people stay home for 14 days after your last exposure with someone who's positive. And listen to what I just said. 14 days following your last exposure to somebody positive. I actually had a client send me a copy of a script from one of our local hospitals who put someone out on quarantine for 24 days. Here's the scenario. The employee's spouse tested positive because they live in close proximity. He has to be quarantined for the 10 days that's the spouse is quarantined. But because he can be exposed and catch the virus on day 9 or 10 that she is contagious, he has to stay home for an additional 14 days. Even though she goes back to her life, he has to stay quarantined for an additional 14 days because he may not show symptoms for 2 to 14 days. Guys, that could be devastating to some of your schedules. Please be prepared. So my message here is, not only can you read that on the CDC website, and I will send you a copy of this if you send me a note, you can't find it, but this is the perfect time when we start talking about preparedness. You and your teams need to be talking about who's cross-trained, who can take those responsibilities if somebody ends up going and having to be quarantined for that long and can't work from home. What are you going to do if a whole department becomes exposed? And Kate's already telling us, if you think you've been exposed, you need to go be tested. If you're waiting for that test, and some tests are taking days, you might be waiting for a while. Look, there's a lot of information here. I had so much more to tell you, but we're at the end of our show. Kate Harrelson, thank you so very much. Stephanie Bird, you were wonderful. Thank you, ICRC, for one more hour. And thank you, viewers, for watching. My name is Candy Pride.